So, we're talking about Clomid usage in fertility treatment. It's basically a medication that helps your body ovulate, releasing an egg, especially when periods are irregular or absent.
Absolutely.
The process relies on coordinating with your menstrual cycle. Typically, you start with a low dose, like 150 milligrams tablet a day for 5 days, picking a specific day, like day 2 or day 5, right on schedule.
Yep, exactly.
And it's really important to take it at the same time every day to keep a consistent level in your system. It's like keeping your engine running
definitely.
smoothly. Now, if a woman doesn't have a regular period, they might need an extra medication, sometimes Provera, to trigger a period, and then that bleeding marks day 1 of the cycle. Then there's the timing of intercourse. Ovulation usually happens 5 to 10 days after the last pill. So, to maximize the chances, it's suggested to have intercourse every other day during that window.
That makes sense.
They can also track basal body temperature or use ovulation predictor kits, sort of like having an internal calendar that tells you when the magic happens.
True, that kind of tracking really helps.
Now, here's an interesting bit. If the first cycle doesn't work, it's common. Many women might not ovulate outright. In those cases, based on blood tests, the dose might be increased in subsequent cycles.
Yeah, I've heard that. It's practice-based, right?
Exactly. It's a bit of trial and error, but with careful monitoring. However, I've sometimes wondered, isn't it a bit concerning that you keep upping the dose if it fails initially? Good point. There certainly is a balance to strike, and that's why there's constant monitoring. If there's no ovulation or conception, after a few cycles, more options are explored.
Right, so you're not stuck on just one method.
Also, there are some mild side effects, hot flashes, headaches, breast tenderness, or bloating are common. But a few people might experience blurred vision or other visual disturbances, which definitely should prompt a call to your doctor.
It's crucial not to ignore those signs.
And then there's the rare but serious risk of ovarian hyperstimulation syndrome, or OHSS, with symptoms like severe abdominal pain, rapid weight gain, and shortness of breath. Any sign of these means it's time to seek help immediately.
That's where being vigilant really matters.
All in all, though, the guide emphasizes that this information is general and shouldn't replace personalized advice from a healthcare professional. Always follow your doctor's specific instructions.
Absolutely, personal medical advice is key here.
It's like you get a blueprint for treatment, but your physician tailors it to you specifically.
Yeah, that's the best approach.
And remember, clear communication with your doctor, from asking about timing intercourse to reporting any side effects, is essential to ensure a smooth treatment process.
For sure, staying proactive really makes a difference.
So, in a nutshell, Clomid is a well-established tool in fertility treatment when used correctly, and with proper monitoring and adjustments.
Got it.
Yep, it's all about following the plan, tracking the cycle, and maintaining an open dialogue with your healthcare provider so you feel supported throughout the journey.
Exactly, and that's what makes the treatment both effective and safe.